It's 9 a.m. from Fox 35. This is Good Day Orlando.
Still to come, more women going under the knife and splurging for flatter abs.
So what is behind this growing trend, and are the results really worth it? Coming up, we're going to talk to a local woman about her decision to get a tummy tuck and the doctor who helped her to slim down. It is 9:26 right now, and you're watching Good Day Orlando. We're back right after this. Well, summer just a short time away now, and a lot of people say it's already bathing suit weather. So they turn to perhaps a tummy tuck to get themselves looking good and confident in a bathing suit. The American Society of Plastic Surgery reports that there were 129,000 tummy tucks last year alone, and that is up 9% from the year before. But looking good in a swimsuit isn't always the reason someone goes under the knife. Joining us this morning to talk more about it is plastic surgeon Dr. Adam Oppenheimer and patient Tara Nesbitt. Thank you both for being here. Great to see you. Okay, so talk to me first about, you had this procedure how long ago?
About 6 months ago.
Okay, so very recent.
Yes.
What made you decide you wanted to do this, Tara?
I had lost about 120 pounds, and I was just not happy with the way I looked at the end of the weight loss. So I wanted to kind of see what I felt as far as being healthy and feeling good, and I wanted it to reflect in the mirror.
Which I want to mention, by the way, that Tara lost this weight all by yourself. I mean, you did this on your own, right? You didn't have any kind of surgery or anything. You lost 120 pounds the old-fashioned way, which is impressive in and of itself. But doctor, I imagine when a patient comes to you after having massive weight loss, what happens is we still have all this skin. The skin doesn't go away, right?
Yeah, exactly. The loose skin, the stretch marks, and the separation in the muscles as well. That's something that happens with pregnancy and with changes in weight. And so the tummy tuck really can address both of these issues by removing excess skin, but also tightening the muscles. And these are things that can't really be fixed just in the gym.
Right. Yeah, because you hear a lot of people say, oh, maybe just a few extra sit-ups. And we're looking at some before and after pics right now. But sit-ups or planks or whatever you're doing is not going to cure that.
No, it won't. And what we do in a tummy tuck procedure is we actually do an internal corset to actually tighten those muscles that get separated during pregnancy and tighten them back up again to restore that nice hourglass figure.
And Tara's also a mom.
I am.
Tell me, after having had this procedure, how do you feel?
Oh, I just, in general, I have so much confidence in it, and it just shows in every day. I'm so happy to just run around with my child and not worry about anything extra hanging out with me. So,
right. Yeah. What about, I mean, have you gotten comfortable enough, like, okay, maybe this summer I will put on a two-piece?
Yes, absolutely.
That's wonderful.
Yes, very much so.
So as far as a good candidate for this procedure, I imagine you have to be fairly healthy to do something like this, right?
Sure, and safety is always the #1 concern anytime you think about any kind of procedure. But really, this is anyone who has stretch marks, anyone who's had a pregnancy, anyone who's had weight changes, and just wants to look better and feel better about themselves.
And doc, do you go in through the belly button? Is that how you do most of the work?
Most of the work's actually done through a low incision, very similar to a C-section type incision that's below the bikini line. But there's also a scar around the belly button as well.
Okay, gotcha. Would you do it again?
Absolutely.
Have you? I mean, do you talk to friends about it and say you've got to go do this now?
Oh yes, best thing I've ever done. Yeah. Big time.
What about cost, Doc? What do we need to know about that?
I usually only get in trouble when I talk about scheduling and money, so I usually leave that to the ladies in the office. But, you know, things like recovery is another kind of major concern. It takes about 2 weeks to get through the entire recovery process till you're getting back to most of your normal routine.
Right, so I imagine no heavy lifting, can't pick up the baby, that kind of thing. So you have to keep that in mind as far as your timeline of when you might want to have something like this done too. Yeah. Okay, all right, so call the office if you want to know how much. They'll tell you. All right, thank you so much, Tara. I really appreciate it. Doctor, thank you so much, and congratulations to you on that weight loss.
Yes,
you look amazing. You look amazing. All right, John, I'm going to send it over to you.